Hello, everyone. I'm Dr. Amal Elkady. Welcome to my podcast, Beyond Medicine, as we take a deep dive into the human behind the profession. Today, I have a great pleasure to have my guest, Dr. Ismail Rady, a distinguished urological surgeon, professor of urological surgery and kidney transplant at Kasr Elaine University Hospitals. Welcome to my podcast, Ismail. Great pleasure to have you here with us today.
Thank you, Amal. The pleasure is mine. I'm very happy to have received your invitation for your podcast, and I hope what I have to say is of benefit and is of interest to your listeners. Thank you very much for having me.
Thank you, Ismail. And to our listeners, Dr. Rady has just come from the hospital where he was operating on a patient, and he will be going to his busy practice in a few minutes, and he's been very generous with giving us this time. So great pleasure to have you. And I will turn it over to you to introduce yourself to our listeners.
So my name is Ismail Rady Saad. I'm a professor of urology at Cairo University, and I specialize in kidney transplantation surgery and urologic oncology and robotic surgery of the urinary tract.
Great pleasure to have you with us today, Ismail.
Thank you very much. Thank you.
What advice do you have for aspiring early career surgeons or interested graduating medical students who may be interested in pursuing a career path similar to yours in urology? And how can an early career surgeon identify that this is the right specialty for them? And the third part of my question is, what does it take to get to be a successful urological surgeon such as yourself today?
I don't want to sound cliche about having passion about a certain specialty, because nobody really has any clue as to what a specialty is when you're just fresh out of med school.
True.
However, you would have to spend some time in this department and see how the residents do their job, how the residents do after they do the residence
shadowing. Maybe.
Yes, there you go, exactly. So urology is a tough branch. It has a tough residency, whatever the country is, whatever the culture is. There are long hours, and a resident in general doesn't make that much money.
True.
So you have to know that the residency is not going to be your lifestyle for the rest of your career. It's only 3 years, 5 years.
Just a phase in your
just a phase, a step in your journey. So you have to give it all. You have to accept. You have to be professional about how to deal with it. One of the things all the residents suffer from, especially in surgical specialties like urology being one of them, is burnt out. You're fresh out of med school and you're probably the top of your class, and when you go in, you don't find what you expected. And this is all across cultures.
True.
It's in the United States.
Cultural shock when you're first into that.
Yes.
Really tough specialty.
Yes. So there are so many ways to how to deal with it. You have to enjoy the fact that you are a resident and that you are taking the specialty that you probably chose. You have to always keep a smile. You have to be prepared. You have to study a lot. You have to have time to rest. You have to eat well. You have to study well. And when you're done with your residency, you also have to know what you want to do afterwards. Do you want to be in an academic career or in a private practice-based career? Do you want to do more research? You want to do or only seeing patients in the office? You want to choose more of a subspecialty like what I did, choosing urologic oncology or transplantation, or you want to be a general urologist, and you have to fine-tune that to what your interests are. Mm-hmm. Don't just follow a path that you think would be good at, and you end up doing something that you're not happy with. But it all comes down also to hard work. Your family have to also be understanding that you will be having long hours away from them, long hours in the office, long hours in the operating room, missing out on family-related events. So having a supportive family is key to the success of any person who has a high demanding job.
Yeah, and so sacrifice definitely in terms of the effort, time with loved ones, but most importantly, being a dedicated, hard-working individual and understanding that all the challenges and the hardships in residency, which is hard across the board, all around the world. We all know
Yes.
the long hours and having to serve a higher number of patients. That's one of the challenges. And what advice do you have for mentees who may be in a mentorship in order for them to maximize the benefit from a mentorship with a urological surgeon?
Well, I'm fortunate enough in being an academic urologist at the end of the day, having an academic position as a professor. So I deal with residents, I deal with chief residents, I deal with junior fellows and senior fellows. Uh, 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 every one of them has a certain personality. And one of the good things about us doctors is that we have what we know as emotional intelligence. We should be able to sharpen this craft where we understand the capabilities of the mentees or the apprentices that we have with us. Uh, each one of them have certain strengths and weaknesses. We have to focus on the strength of an individual, avoid their weaknesses.
Do you customize a mentorship
Absolutely.
program? Because I wanted to ask you my next question, which is, as a mentor, what is your philosophy? And how do you carve out a unique path for each one of your mentees to help them accomplish their goals in the mentorship?
Across the board, there is a kindness. You have to be kind to your junior staff because kindness remains, and kindness kind of brings up the true potential. And there's also a sharp line between being a friend and at the end of the day being a mentor, and being able to walk this thin red line between being close to them on a personal level and at the same time maintaining the image of someone who's older and wiser, supposedly wiser. Delegation, showing them that you have confidence in their abilities.
How do you empower them in the
giving them
theater?
tasks and follow through, giving them room to make decisions, and to giving also them the skill to know when to take decisions on their own as opposed to when to ask.
From more experienced
Yes,
opinion.
understanding their surgical skill level so that they can proceed with surgeries that fit their skills, as opposed to when to stop and when to ask for help. Also, not overlooking the developing their soft skills in doing research and giving out lectures and preparing lectures, in writing abstracts and manuscripts and book chapters. Not overlooking the didactic part of their career path, and only focusing on technical skills in the operating room, because it's also
So you're giving them a well-rounded,
hopefully, yes, getting to
experience.
know their family, and sometimes asking helping out with any family issues they have. At the end of the day, we're all human beings. We face challenges in our lives. So, and these are one of the things that I learned when I was in the United States, is that all the mentors that I worked with and I was training under them, they also got to know my family and helping out, and it really helped out a great deal. And socializing and bonding in parties or in dinners and all of that. And these are one of the main. I saw my father do this also with his junior staff, having dinners for all his department and all the people who trained with him.
So you raised an amazing perspective to the mentorship, which is kindness and the human aspect of being a mentor, and not just focusing on the technical skills. So perhaps this can be helpful advice also for mentors,
Yes.
or surgeons who are looking to become mentors for mentees. So what would you like to say to them, for those who are interested in becoming a mentor themselves?
Well, don't make it stop at you. Stop at where you have it. I mean, pass it on. Pass knowledge.
Pass the baton.
Yes, pass the baton. Pass it. Pass the knowledge you have. Pass the skill you have. Pass the information that you acquired, the knowledge that you acquired. Pass the kindness. And I'm sure, because if you make it end where you have it right now, at some point the well is going to dry. Like, for example, if I didn't come back and pass on the knowledge or the technique of doing an operation or the skill of dealing with residents and junior staff, it's not going to be passed on, and what I think I'm doing a good job at is not going to be passed on to people who may not have been fortunate enough to have the chances that I had when I traveled abroad. So you need to pass it on, pass it on, pass it on.
I love it, Ismail. And when you mention that you're bringing back the experiences and the wealth of knowledge that you've acquired through your hard work and diligence, and also the unique training programs and mentorships that you've been fortunate to have in the United States and other parts of the world, and to transfer that. That's very important, to transfer these skills and experiences, because I feel in science in general and in medicine, unless we have this unique free flow and exchange of ideas, we are unable to progress towards more innovation. It comes from all these experiences and then testing them. And then also there's the unique challenge of, at what point should a surgeon realize that maybe surgery is not the right specialty for them?
Well, I think it starts off in residency, and I've seen this situation a number of times with residents and junior residents who chose the branch or the specialty urology just because they had a vacant spot and they can just be at that spot. And maybe 2 months, 3 months into it, they started to struggle because they can't take the stress, or they do not have the skills, not necessarily the hand skills, because nobody has hand skills when they start, but the social skills, the resilience that is needed to go through such a tough residency. And I've seen this a number of times, and so many of them were honest with themselves, and they just backed out and went into other specialties where they prospered and are doing much better.
And that's okay too.
Yes, that's fine.
Yeah, it's okay to, if this is not the right fit for you, it's okay to identify that and then realize, and then change course, and be successful in a different specialty, if you will. Let's switch gears a little bit and talk about work-life integration, because now we touch base on the challenges of being a surgeon in training, and then choosing the subspecialty in surgery, and with all the challenges and sacrifices that come with that. How do you achieve work-life integration? And I do know you have many interests outside of medicine, so tell us about that. How do you achieve that balance personally, and then your advice to young surgeons or early career surgeons in making sure that they too can have that balance and achieve it? Because I strongly believe it's very important, especially to your point earlier about physician burnout or surgeon burnout. So tell us about that.
Well, I can say I'm doing a good job at maintaining the balance or the work-life integration.
I know you work very hard.
Yeah, all surgeons have to work very hard. However, maybe early on in my career, I maybe overlooked the life part of, or the interest that I had before. When I was a medical student, I was interested in music, and I was playing. I play musical instrument. I play the drums.
I'm a drummer.
Yes. However, when I started my residency, I completely gave that up.
Did it go into the garage?
Yes, I actually sold the kit that I had.
Oh, you did?
Yes.
Okay.
And I probably dropped that for a good 10 years, between 1998 when I started the residency all the way up to 2008 when I was done with the training at the US. I bought a drum kit and brought it back to Egypt with me, and I started gradually building up my skills again and starting to play. However, again, also when I returned from the United States, I was busy also building my practice here in Egypt. So I can only say that I only started to get back to my interests when I had relatively a stable career, when I was probably 46 or 47.
When you had a rhythm, sort of?
Yes, more, so to speak, yeah. So I am now 49, almost 50. So about 3 or 4 years ago, I started really focusing on playing music again, and I had also an interest in cinema. So I joined a friend of mine who has a very a moderately popular, or a relatively popular podcast about movie review and film review. It's called Cinematology. His name is Mohammed Abu Sliman.
Watch it.
Yes, it's called Cinematology. It's a podcast. Mohammed Abu Sliman, my dear friend, started it. several years back, and it has now more than 100,000 followers. So he used to do these video essays about movies and about film and cinema, both Egyptian and foreign and American. But for the past year, he's been focusing on having it as a podcast, like the one we're here on now. Yeah. And we have this, and he asked me to be a co-host with him. And this is also one of the things now that's keeping me busy. As in addition to my work, I have to prepare for the podcast, I have to watch a movie, I have to take notes and do whatever he asks us to do. And it's keeping me busy, and it's giving me a new dimension in my life now. I always tell him that cinematology gives me a new perspective to life now. Maybe now that I have a relatively stable career, so I can focus on all these extra career activities.
This is wonderful. So from music to being an avid drummer to cinema critique. And I personally enjoy watching your episodes with him on the podcast. So let's go back to your earlier days before going into medical school. I suppose perhaps a large number of fellow physicians and fellow healthcare professionals around the world might find this resonating with them, is that each one of us had other interests. Perhaps we thought we, wanted to pursue a career as architect. I myself was very interested in architecture, but at the same time, I was interested in the human body and being able to do things manually. That's why I went into dermatology, because there's this blend of doing procedures, not as extensive as what you do in urology, but at the same time, it combines that craft. Other people may have interests in art or different aspects in life. So in your earlier days before going into medical school, how were you able to determine at a very young age, I suppose, because we're all teenagers when we're making these big decisions. And I think of that because my oldest son is a high school senior now, and he's going through the same decisions. And I think to myself, wow, these are big decisions that we made at a very young age. How did you make the decision to go into medical school?
Well, I can't say that I made a decision.
Okay.
For me,
was it in your DNA?
Yeah, no, I can't say it. Yeah. No, I mean, for me, going into med school was kind of intuitive. My father was a doctor, and so I did not imagine doing anything else other than being a doctor. It may sound naive. However, that's the way it was for me.
Role model at home,
yes, yes.
And
however, if time went back, I would do it again. However, now that I have the time, I would like to spend more time in more artistic activities and artistic crafts like cinema, and probably also cinema behind the camera, in writing scripts or directing movies or reviewing movies. Probably this is what I would have liked to do if I had more of a choice or more of an understanding of what to do in life when I was 15 or 16 or 17.
And then I remember you were one of the youngest
yeah.
first year medical students.
Yeah.
I think you skipped 2 years in high school, which is a challenge in itself, right?
Yes, yes.
What advice or what would you say to your younger self then?
Well, I'm looking back. I actually got into med school 4 years earlier, as you said 2. It's actually 4, and I believe that this was not the wise thing to do.
So you would have held back.
Yes,
because we know a lot of times, either the students themselves are excited and they're able to.
I was excited at the time.
More advanced levels and skip, but then sometimes, now modern days, parents are trying to think, should we hold
modern
it back?
day education, I guess, is against that.
Yeah.
My son is on the eldest part of his classmates, and I guess this helped him a lot to mature enough and to be able to choose what he wants when he studies law. And he made this decision. Yes, at the University of Zurich. So I guess it was all his decision, what to study and where to study it. And I guess he was 17 or 18. At 17 at the time, much wiser than I was when I was at his age. When I was his age, when he got into law school, I was already in 4th year medical school. I believe this was not entirely right. It was the trend at the time. But if I was to do it again, I wouldn't have done it the same way. maybe I would have still got into med school, but I would have
You would
done
have
med
held
school
back.
in a different,
Yeah.
I would have handled medical school in a different way.
Ismail, let me ask you a question. What are some of the challenges, in your opinion, from your expertise and perspective, that may be facing the specialty on a local level and a global level, if you will, and how to overcome these challenges, in your opinion?
Well, the main challenge the medical service in general is facing in Egypt comes down to the fact that Egypt has been facing a tough economical situation because of the devaluation of our currency that resulted in inflation and increasing prices of everything. And since the medical service in Egypt or in general is reliant upon us importing technology, supplies and equipment, so the result of the service has the result is the price of the service being more expensive.
And we do have a lot of people coming from other countries in the
We
region.
do. Egypt has always been a hub to a regional hub
because of the expertise.
to patients being seeking treatment from neighboring Arab countries and North Africa, and even throughout Africa itself, seeking treatment in Egypt, to the quality of the service, the number of hospitals, the number of good hospitals.
And I've seen also patients come from the UK, I remember, because of perhaps long wait times to get
in
surgeries,
the NHS,
whereas in Egypt we do have a great advantage, I must share, that wait times to get operated on are among the shortest.
So despite the fact that the medical equipment has seen the price of medical equipment or importing medical equipment to Egyptian hospitals, whether they are government-based hospitals or private hospitals, has recently increased, we're still able to not be far behind than what's happening. So Egypt now, Cairo at least, has 3 surgical robots. We have at Cairo University, we have 2 maybe at private hospitals, and 2 and another at NHS. So we actually have 4 robots.
So tell us about that program, because I remember you were one of the early surgeons in your specialty. To be trained and also to train other surgeons. Tell us about that.
So in Egypt now, probably like 3 years ago, 4 surgical robots have been installed in 4 different Egyptian hospitals, all urology-based programs. We have Cairo University, we have Ain Shams University, which is a big another big university in Cairo, and we have, in addition to, also 2 other private-based hospitals. So between all of those, we have 4 surgical robots operating heavily and doing very advanced surgeries for prostate cancer, for kidney cancer, for bladder cancer, and reconstructive surgery also in pediatric urology. And this is not far off from what's happening outside Egypt, in the United States or in Europe. So this is the main challenge we're facing. Also, the other challenge we're facing is that we have so many doctors graduating from Egyptian universities, and the result is so many of them leave the country to train or practice outside the country, in the UK, in Europe, in the Middle East, and of course in the United States. So we can say we're suffering a bit of a brain drain, which most countries similar to our situation are facing. I'm sure India has the same situation, Pakistan have the same situation, Lebanon, Jordan.
Which is a gain for the countries they go
I guess, yes. You have so many examples of.
We do have
so many examples. So many examples of top docs in practicing in the United States, Egyptian top docs practicing in the United States, in Europe, in different countries in Europe, in the UK and in Europe, in Germany, in France, Australia, absolutely, and also
Japan,
in the Middle East.
Japan,
I haven't heard about Japan. However, the Middle East.
I have a brother of one friend at least who's.
I'm sure there is.
Who's
just because I don't know about them.
He fell in love with a beautiful Japanese lady, and in fact, they settled down there. So at least we have.
I wasn't aware of that. So Egyptian doctors, because we get good training, we're hard workers. So it's a bit of a brain drain because we lose all these good talent to foreign countries. However, so many of them train doctors who travel. Like I trained also in some part of my training in the United States with Egyptian doctors as well. So it's a gain. I can't say it's a loss. It's maybe a short-term loss. However, it's a long-term gain.
So on the global level, perhaps there's more mobility, if you will, of doctors around the world.
Yes.
So Ismail, thank you so much for your time.
Thank you for having me.
And
I
you've
really
been
enjoyed.
very generous with your time, and I love the energy. I'm sure and hope that this episode featuring Dr. Ismail Rady's journey and career path as a successful and distinguished urological surgeon and kidney transplant surgeon would be inspiring for young physicians, medical students, early career surgeons, and anybody who thinks that they might want to become a surgeon. So thank you so much.
Thank you for having me. I really had
today.
fun. It was an honor being on your podcast. I hope to be here again.
Absolutely.
If the opportunity happens.
Thank you so much, Ismail.
Thank you for having me.
Thank you. Great pleasure. All right, everyone. Thank you for your time watching this episode, and stay tuned in for more episodes to come. Bye-bye.